Rubella, also known as German measles. Rubella is a contagious viral infection best known by its distinctive red rash. It's also called German measles or 3-day measles. While this infection may cause mild symptoms or even no symptoms in most people, it can cause serious problems for unborn babies whose mothers become infected during pregnancy. Rubella isn't the same as measles, but the two illnesses share some symptoms, including the red rash. Rubella is caused by a different virus than measles, and rubella isn't as infectious or as severe as measles. Rubella spreads when an infected person coughs or sneezes. Also, if a woman is infected with rubella while she is pregnant, she can pass it to her developing baby and cause serious harm. A person with rubella may spread the disease to others up to 1 week before the rash appears and remain contagious up to 7 days after. However, 25 to 50% of people infected with rubella do not develop a rash or have any symptoms, but they still spread it to others. People infected with rubella should tell friends, family, and people they work with, especially pregnant women, if they have rubella. If your child has rubella, it's important to tell your child's school or daycare provider. Pregnancy and rubella. Rubella is very dangerous for a pregnant woman and her developing baby. Anyone who is not vaccinated against rubella is at risk of getting the disease. Although rubella was declared eliminated from the US in 2004, cases can occur when unvaccinated people are exposed to infected people, mostly through international travel. Women should make sure they are protected from rubella before they get pregnant. Infection with the rubella virus causes the most severe damage when the mother is infected early in pregnancy, especially in the first 12 weeks, which is the first trimester. During 2005 to 2018, 15 babies with CRS has been reported in the United States. Congenital rubella syndrome. Congenital rubella syndrome, also known as CRS, is a condition that occurs in a developing baby in the womb whose mother is infected with the rubella virus. Pregnant women who contract rubella are at risk for miscarriage or stillbirth, and their developing babies are at risk for severe birth defects with devastating lifelong consequences. CRS can affect almost everything in the developing baby's body. The most common birth defects from CRS can include deafness, cataracts, heart defects, intellectual disabilities, liver and spleen damage, low birth weight, and skin rash at birth. Although specific symptoms can be treated, there is no cure for CRS. Since there is no cure, it is important for women to get vaccinated before they get pregnant.
Signs and symptoms. Children and adults who exhibit symptoms of rubella usually have a red rash that first appears on the face and then spreads to the rest of the body. This lasts for about 3 days. Individuals may experience the following symptoms 1 to 5 days before the rash appears: a low-grade fever, headaches, mild pink eye, pain and discomfort, swollen and enlarged lymph nodes, coughs, and runny nose. Between 25 and 50% of infected people with rubella will not experience any symptoms. Treatment/outcome. Rubella can't be treated with a specific antibiotic or antiviral medication. In many rubella cases, the symptoms are usually mild and infected persons make a full recovery after a certain period. However, symptoms of rubella are treated with drugs prescribed by doctors. For example, a doctor will prescribe paracetamol for their patient if they are suffering from symptoms of rubella such as pain and fever. Prevention. Even though there is no real treatment or cure for rubella, people can take these precautions to avoid infection. People infected with rubella should avoid contact with coworkers and friends until they are fully recovered, or at least until 4 days have passed since the onset of the rash. Take the measles, mumps, rubella, MMR combination vaccine or the measles, mumps, rubella, and varicella combination vaccine. These vaccines are considered as the best way to prevent being infected by rubella, as most people who take 2 doses of any of these vaccines are protected against rubella. However, vaccination after exposure to rubella will not prevent infection. Global incidence. In 1964 to 1965, a major rubella epidemic hit the United States. An estimated 12.5 million people were infected, 11,000 pregnant women lost their babies, 2,100 newborns died, and 20,000 babies were born with congenital rubella syndrome (CRS). However, as soon as the rubella vaccination program began in 1969, these numbers declined significantly. Nowadays, less than 10 people in the US are reported as having rubella each year. Since 2012, all rubella cases have evidence showing that the infected persons became infected when they were traveling or living outside the US. According to statistics taken from the World Health Organization (WHO) in 2019, China had the highest rate of rubella cases in the world at 32,539 cases.